So I think we're going to kick off. Sagit, are you here as well?
Yes, I'm here.
Okay, perfect. Thank you to everyone who's here joining us today for our webinar on a new approach to enhancing outcomes in inpatient rehabilitation. I'm Darren Gladstone. I'm the marketing director here for GaitBetter. I'm based in Rockville, just in Maryland, just outside DC. And today we're going to spend hopefully less than an hour. We'll go through this as we can and leave plenty of time for questions and answer session with you. And today we're going to have three main speakers. Just let me get my slide moving. Today's presenters are Hilik Harari, who's the CEO and co-founder of GaitBetter. Also Sagit Giterman, who is our product manager and clinical leader here at GaitBetter. And then joining us in about 20 minutes or so, when she finishes a previous engagement, will be Dr. Faye Bronstein, who is the senior clinical instructor from NYU Langone in New York. She has been a wonderful partner for GaitBetter over the years, using our system, putting many patients through the system, reaping the benefits of that. So Dr. Bronstein is going to come along and talk about her experiences with the system and also be available to answer questions. And the agenda for today, first of all, Hilik will give an introduction to GaitBetter, to the company, to the background, and then Sagit will take over and talk about the kind of clinical overview, how the system works, the outcomes, and share some real world examples of the system working in inpatient rehabilitation settings. Then we'll have the discussion with Dr. Bronstein, and then we'll leave plenty of time for Q&A. So with that, I will invite Hilik to kick us off.
Thank you, Darren. And hi, everybody, and thank you for joining this webinar. Happy to see some of familiar faces and some new folks. So thank you again for joining. I'll try to be very brief, just to give you a sense of what GaitBetter is, how did it come to life, and really a bit of a background of what led us to that point. So GaitBetter we've been around for the last almost getting to 8 years now, spanned off from a research institute, Tel Aviv Medical Center, that did a lot of work around motor and cognitive intervention. But not only in Tel Aviv, right? The numerous data points that show us that gait, walking abilities, and cognitive function are tightly related. And that's what got us to think, or the research team behind GaitBetter, it showed that if we do an intervention that mix up both motor and cognitive practice at the same time, we may lead to better results. And that's how it all started back in almost 15 years ago, where they first looked at what type of outcomes and what type of patients we can treat to address the gait disorders by mixing up cognitive elements with motor exercise, doing it in an objective way, measuring it in an objective way, and being able to do it more efficiently. So next slide, please. And the way that they've built it was to try to get many different elements that I'm sure Sagit will touch on later, try to get different elements bundled into one experience that the patient will walk through. One of the elements that I'm sure Faye, that is on the call, will probably mention is about the gamification element of it. we've seen that by doing an exercise, having an intervention that is gamified, we can significantly increase adherence to treatment. Obviously, mostly in outpatient units, but as well as in inpatient, we can increase motivation. We can get much more out of a patient and hence get much better results. But the virtual reality, the tool is just a tool that allows us to achieve things that it is very hard to achieve otherwise, right? So it's really was created from a need to get to better outcomes, and then selecting the right technical tools and building it in the way that maximize outcome. And I hope that through this presentation, you'll get a much better understanding of how that is being achieved. If we can look at the next slide, I'll show a quick sample of what makes GaitBetter. So GaitBetter is an add-on to existing treadmills. We are not selling treadmills. We're not in a business of selling treadmills. We add virtual simulations to existing treadmills. The solution is, I often use the word simple, although it might sound simple, but it's actually very difficult and very challenging to build simple things. So it seems, and the concept is quite easy, building it again is quite challenging. Imagine that there is a camera in front of your existing treadmills. The camera will analyze and track the foot movement of the patient as they walk on the treadmill. And so the patient is walking on the treadmill, they'll see the foot movement onto a simulation displayed on a front screen. We're not using the goggles because we've tested it, and we've found that people will typically, when they're walking, they will immediately lose balance when they use fully immersive virtual reality. Hence, we call it semi-immersive virtual reality. So you're walking on the treadmill, you see your own foot movement into the simulation, and then you engage in a gamified exercise that involve motor and cognitive challenges. And if we can skip to the next slide, we'll see a quick video of how that looks. So hopefully the sound will also be shared there. And if not, I can explain what's going on.
There's no sound so that you can describe actually what's happening.
All right, perfect. So let's start. We do use a harness. If you have a harness in your inpatient unit, by all means, go ahead and use that. If not, we can provide it. It's only for safety purposes. It helps with really quick setup. I see the video is not moving that fast, so we'll see if that moves better. Yeah. So setup time takes literally, a minute, right? Put a harness on. If it's our harness, it's really, really quick. If it's any other type of a harness solution, whatever, it takes time to do it. Once you get the patient ready with the harness, you can start the training. You'll have a touchscreen monitor where you can administrate and control the exercise. But as I explained, the system will track the foot movement of the patient. You'll see the foot movement onto the simulation, and then you can select from different type of exercises, each exercise triggering a different type of executive function skill. So we have exercises that are more built to decision-making, to memory exercise, to attention capabilities exercise. So each one of those selected games are tuned to trigger other type of executive function skill. And then what's really nice about it is that you can really control any aspect of the game and really adjust it to your patient needs, right? So it might seem difficult, but we have patients from all types, from a very, very low functional people, maybe even having exercise while standing and just changing weight. Again, I'm sure that Sagit will show some of that. To patients at a very high level function, both in inpatient, but often in outpatient and even wellness type of setting. So with that, I believe, maybe just one word on that. Thank you, Darren. Everything that I just said is solid proved. We've completed 8 clinical trials to date. We have 24 peer-reviewed publications and some additional work that have been done that was not even published yet. More publications are on the way. We've seen that type of technology, our technology, helping in various matrices, both on the motor side, the gait side, but also on the cognitive side, and eventually preventing or reducing the risk of falls in stroke survivors, in Parkinson's patient, in MS, people with MS. Our users, our therapists and clinics are using it for a really wide range of indications. We've proved it on many that I mentioned, but in practice, it is being used really to the extent of your imagination. We have anyone from, pediatric population to amputees, to various neurological conditions, and obviously all the adults. So we'll be happy to share with you all of that if you need to. And I don't know if we have anything else there. Yeah, and it's been adopted already by close to 150 clinics, mostly in Israel and in the US. Some of the top leading rehabilitation hospitals and centers in the US already using it. You will hear today from New York University Langone. We have systems at Oshner Healthcare, Burg, VA, who did brilliant work both on a research side, but also in practice and medical practice. We have it in Spalding Rehabilitation in Boston and Jefferson Health in Philadelphia. So we have quite a few already. And again, both in Israel and in the States, both in inpatient and many outpatient clinics. So I think that's my end, and I'll switch it over to Sagit. Thank you, everybody, again.
Thank you, Hilik. Just before Sagit, I want to welcome Dr. Bronstein, who's here. And after Sagit will talk for about 10 minutes, and then we'll get into with Dr. Bronstein. The Q&A is open, so if anyone would like to write any questions there, we can answer them as we go along, or we can answer them at the end. But feel free to use the Q&A section or the chat and leave any questions there. So Sagit, over to you.
Thanks, Darren. Hi, everyone. My name is Sagit Giterman. I'm a physical therapist by training and also the product manager of GaitBetter. And I want to show you and talk to you about giving you more clinical overview. So Darren, this is a video, you can play it. So GaitBetter works in inpatient rehab because it's built to serve a wide variety of patients, from low to mid and even high level patients. It's not replacing the therapist, it enhances the therapist what we already do, just doing it better. It's easy and friendly to use by the therapist, easy to learn, easy to use, and as Hilik talked about it, is fast setup. So it's not time consuming, and we have clinical outcomes across inpatient rehab. So while we're watching this video, you can see this is taken 2 weeks ago in Pennsylvania in a nursing home, and this lady is a COPD. She's not really engaging, and before and after the training, she went to a cigarette. She's not doing any physical activity, and as you can see, she's walking. She's engaging with the cognitive game, so she has to walk and cross obstacles on one hand and identify a cat that appears in the environment for several seconds, and she needs to react to it with clicking the buttons on her hand. So while she's walking, she's actually playing a game. This is the gamification element, and by that she's increasing her walking time, walking speed sometime, and she's not really feeling it because she's playing the game. She's concentrated in the game and achieving the good results, the best result. Darren, can you move to the next slide? So we all have physical limitations in our clinic. The clinic, if we want to practice, half a mile of walking, we cannot really do it. We can maybe do it in the corridor, but sometimes it's too narrow, it's too small, it's too crowded. We always have physical limitations, and we don't have enough time to do it. We want to be with our patients. If I want to make an obstacle course, I have to find a place, go and bring equipment, set it up, and walk with my patient while keeping it safe. GaitBetter packs it all into the treadmill. So by walking on the treadmill, you're overcoming all the physical limitation. The safety harness helps patients to feel safe and support, and even access this kind of training to patients that would normally would never go on a treadmill, or we as a therapist would never put them on a treadmill because they're concerning or it's not safe enough. So the harness really makes it happen. Longer walking time, more steps, more practice in less effort from me as a therapist. And from the therapist, from the patient's perspective, it increases their motivation. They always strive to achieve more, to cross more obstacles, to get more points, to find more cats and repeat the sequences. It helps with the endurance in the short term. So during the specific session, they want to. Sometimes patients that can practice walking for 2 or 3 minutes will surprise you and walk for 5 or 6 consecutive minutes. And it also helps in the adherence in the long term, so they want to come back and try again and achieve more in the next time. Yeah, the video is quite stuck. In this video that I hope it will work, you can see lower level settings where some of the patients are actually came with the wheelchairs, so they're not independent ambulators or walkers. This site use their own harness system. But all of the patients, regardless of the indication, neurologic, orthopedic, geriatric, cardiologic, lung disease, vestibular, they all can enjoy a safe and engaging training while engaging both motor and cognitive skills. So just walking and seeing the simulation requires them to walk more upright with head with eyes in front. They have to constantly calculate their step and assess when the obstacle is coming, raise their feet in the right time. So it's not like just walking on a treadmill where everything is quite automatic. Here you have to change and adapt your gait pattern in order to time right to when you're actually raising your feet high enough or long enough to cross the obstacles. This together comes with additional cognitive gains. So you can say it's dual tasking, but it's even multitasking. Everything the software has an automatic progression that adapts to the patient's performance. So if someone is doing good, they will gradually increase the difficulty level. So the challenge will match. And in the reverse case, if somebody is not doing so good, they can regress to easier difficulty level. In addition to that, on top of that, me as a therapist have a fully control of every element of the game: the speed, the time, the obstacle side, the obstacle size, the frequency between, the lighting in the environment, what type of game. I can control everything with the click of a button immediately during the game or before the game. Because it's easy and safe, so one therapist can operate and supervise 2 patients, so one of them on the GaitBetter after he's got familiar with it while attending another patient in the room. And I can work with it in several positions. So for lower level patients, as we can see in a few videos, we can work only in standing exercise, leg raising, coordination, balance. Then we can move to supported walking with the harness and fully hand support. And gradually we can even take advantage of the harness and reduce the hand support by removing 1 or 2 hands while actually walking. Okay, so different patients. Some of the videos here are old, so if you see some of the patients wearing a colorful thing on their shoes, in the previous versions we used color markers, but in this current version, the feet tracking is completely markerless, so you don't need any external sensors or anything. Just put your patient on a treadmill and the camera identifies the feet. Okay, I think we can move to the next slide there. In this video, you can see a stroke patient, a left hemiplegic patient, that in addition to practicing unsupported or without unsupported walking, he's practicing coordination, step timing, step height. But another thing, because we therapists want to emphasize working on his left arm reach, so we set the elements of the game so they will appear more on the left side and forcing him to use his left arm to click the button. So it's a secondary goal, if you will. It's not really a straightforward walking, but it's another important goal for chronic stroke patients, and he can do it while actually walking. So you're getting training by walking, cognitive engagement, and upper lip coordination and control. Okay. In this video, you can see an amputee, a young amputee, so he's walking quite faster. And if you can take a look at the obstacles on the screen, you will be able to see that they're much higher and much frequent, which make a lot more challenging. So it can accommodate even higher level patient that can walk fast and can deal with even dual tasking, so we can make it challenging even for them. Or on the other hand, we can really reduce the easy and control every element, so make them walk even without obstacles or just the cognitive game, or really easy game and obstacles so they can have their winning and achievements. It's easy to use, it's not time consuming, and you can use it in many ways. You can use it either within your PT session. So this part of gait training, after you did bed exercise and balance exercise, you can easily put your patient on GaitBetter. You can use it as part of a group therapy, as a station in a group therapy. You can use it as a standalone training program for improving the walking ability, reduce falls, cognitive engagement, and a lot more other things. Next slide there. So in this video, you can see patient training on GaitBetter just in standing up without walking on the treadmill because they're in a lower functional status. This guy is 96 years old. He came to the treadmill with his walker. So even before pre-gait training, if your patient can stand up for your training, when you doing some exercise with him in the physical therapy room, they can definitely use GaitBetter even in these stages. So your treatment, your standing exercise will be longer and will be more intense. They can practice again leg raising, balance, hand coordination, and cognitive engagement. For them, they're playing a game. For us, it's easy and friendly to use and effective. Yeah. Yeah, the video is quite lagging. All right, we have another slide there. All right, so to sum it up, GaitBetter is a great tool. It's a motor cognitive, it's added cognitive to walking training. It's safe, you can use your harness, and it makes it accessible to a lot of your patients. The diagnosis doesn't really matter, it's the functional status. If they can walk, if they can stand, if they understand simple instructions, they can definitely start training and benefit from GaitBetter. For us, it's fast and easy to use. It's not time consuming, less than 2-3 minutes, and we're ready to go. For the patients, it's motivating. They want to achieve more. They're getting feedback. They're getting scores. You can track the report and show them how they progressed in crossing the obstacles and successing the game. It's create more intense therapy for walk longer, stand longer, engage longer, heartbeat, steps. Everything is more fun when you're playing a game, and it serves multi-purposes. You can do it in different settings with different patients.
Thank you. Thank you very much, Sagit.
Thank you.
Thank you for explaining that. Again, the Q&A is open if anyone has any questions. or comments that they would like to share there, and we can answer them as we go along. We're now coming to the final part of today's webinar, and I want to invite Dr. Faye Bronstein, who is with us. Dr. Bronstein, are you here?
Hi, everyone. Yes, I'm here.
Hi. Good afternoon.
Good afternoon. How is everyone?
We're good, thank you.
Great. Did you want me to just present, or do you want to ask?
No, I'm going to. We have a number
Okay.
of questions
Excellent.
that we thought we'd use as prompts to I guess take you through the journey that you've had with GaitBetter, and to share your experiences and your feedback and insights for all the clinicians and rehab professionals who are on the call today. So maybe you can just introduce yourself and your kind of background with GaitBetter.
Sure. Yeah. So my name is Faye Bronstein. I'm a physical therapist, and I'm the clinical specialist here at the NYU Inpatient Rehab Department. I have board certifications in neurology and geriatrics. So virtual reality and gait training are really big passions of mine. I was one of the clinicians that really sought after the GaitBetter for our setting, because we were really looking for a low footprint but high quality device to gait train our patients. There's a lot of great research in virtual rehabilitation, and just the engagement in patients and making sure that we get great outcomes. So that's how we came upon the GaitBetter system, and we've been really happy with it.
Great, thank you. Thank you for that introduction. So tell us a little bit then about how GaitBetter supports you and your other therapists in your team delivering, engaging strategies, engaging sessions for your patients, complex medical patients as well, because I know that you see such a wide range of patients in your facility. Tell us a little bit about that.
Yeah, absolutely. So, we were really looking for a semi-immersive device that, like I said, we're in New York City. We're in a kind of, not a very spacious environment. So we really wanted something that our patients can feel somewhat immersed in, have some sort of distraction or ability to really aid in their gait. So we chose the GaitBetter as a trial and have had it for many years now. And our therapists really use it for a variety of things. We use it for, balance training. We use it to improve walking time, walking metrics. We have a really strong push here for high intensity gait training. And in order to really push somebody past their comfort zone, be able to push somebody past their initial level of fatigue, you really need kind of an engaging environment. So over the years, we've used the GaitBetter to really get our patients moving, and allowing them to kind of see their feet on the screen really helps them to have good buy-in and really get excited about their walking ability.
And you're saying you get them excited about their walking ability. So that leads into what changes then do you see during their period of using the system?
Yeah, I mean, we know in neurological physical therapy practice that the more steps you take, especially during the early stages of recovery, the better the outcomes are going to be. So I think getting someone set up in an immersive environment where they can work on weight bearing, work on obstacle negotiation, work on dual tasking, and start to incorporate some cognitive tasks into their gait training is an excellent tool to really have the patients fully full buy-in and full excitement into gait training. And someone who maybe initially walked for 3-4 minutes at a time on the treadmill and would want to break because they were just really honed in on their fatigue or the difficulty of the task, can really use the GaitBetter as a great distraction tool. They really get, gamifying things really gets people motivated. They try to step over the obstacles. They try to achieve the tasks. And then when you start to break down the subcomponents of gait, we can really kind of manipulate the system to work on those subcomponents. So if I really want to work on left-sided weight bearing, maybe I'll put all the obstacles on the right side to really get good stance control on the left side. If I want to work on left-sided foot clearance, maybe I'll put a lot of the obstacles on the left side and really have that patient try to lift their foot over the obstacles and work on kind of engagement that way. So I think overall, just the increase in walking time, the increase in intensity that we're able to achieve, where we see just better functional outcomes overall when using systems like the GaitBetter.
Yeah, and I think you used the word distraction there, which is a key component of what we do, and that dual tasking element leading to that distraction in a positive way is so important that people know they don't realize that they're walking. The walking becomes almost a side issue as they're engaged within the game, and then that has the benefits. And as a parent to 3 teenage children, I can say that distraction, spending suddenly 4 hours on an Xbox seems to pass them by very quickly. So 5 minutes walking in a GaitBetter, playing a game, being involved in a game really does pass by quickly for our patients. Do you have any specific examples? I know obviously when it comes to patient confidentiality, we would never ask anyone to share information, but do you have specific examples perhaps of patient outcomes around, we've written here, balance, gait speed, confidence, reduced fall risk? Is there anything you can share in particular patients?
Yeah, I mean, I think there was no formal studies done, but I've certainly done some case studies, and I've done some case series that I've kind of created posters for at different conferences. And one thing I looked at closely was, knowing that high intensity is really my goal, is to have the patient walk as long as they can and at the highest intensity that they can to really promote neuroplasticity. Working with the GaitBetter, I've kind of looked at what a patient looks like at their kind of preferred walking speed or their fastest walking speed they're capable of without virtual reality, and then what it looks like when you add virtual reality. And we really saw some really nice changes. Patients on average could walk about 10 minutes longer. When I looked at like a group of, a subset of like 9 patients, they were able to get their heart rate up almost 8 to 15 beats per minute faster. So all of those are really, really important outcomes. And I think when we see those outcomes just within the sessions, then we know that those translate to better functional outcomes. So better 6-minute walk test distance, better 10-meter gait speed, scores. So without looking, we can't correlate them completely because it's not a formalized study with, a control group, but I could say just anecdotally that having the patients engaged, having them walk faster, has certainly led to more improvements and better outcomes for them.
Great. Thank you with that. The inside our company, and over the years, when we talk about what our mission is and what we do, we're always talking about the ultimate goal is to help people. We want to help people improve their mobility. We want to help people reduce their fall risk. But in order for us to help the ultimate end user, the patients, we have to help rehab professionals to deliver better levels of care, better levels of service, better levels of rehabilitation. So I wanted to kind of end with you, Faye, on how you've used or how you've seen GaitBetter maybe help within the clinic setting for you guys, for you rehab professionals, around maybe operational, advantages, practical benefits, how it's really helped within the clinic setting for you as professionals.
Yeah, I mean, in using GaitBetter from kind of the earlier days of development, I have to say that the support group and the ability to take feedback from us has been incredible. Even though Sagit and Hilik are in Israel, if I call them at any time, they will get up in the middle of the night to talk to me and work through any issues that I have. And I think we were really one of the first groups to use it with patients, that needed a lot of physical assist and had severe neurological deficits. And they were really great about kind of taking our feedback with every update that they have. There was a lot of adjustments to the programming. And I think over time, as the results we're seeing, they're just constantly working on bettering the programming and adding more cognitive tasks, adding, a newer addition that we're using, very often is something for spatial neglect, where somebody has to attend to the left or the right side of their environment. And, in rehab, especially after someone suffered a stroke, this could be a really big challenge for them. So doing it in this type of engaging way where you have to kind of scan while you're walking is much better than kind of a traditional way where we might have them, just say, look to the right, or have them look for cones throughout the hallway on the right side. It's a way that the patient can really feel immersed in it and feel successful, with the feedback of the machine as well.
Great. Thank you so much for that. I know that you have another engagement that you have to go to shortly. So before I let Faye go, does anyone have any questions that they would like to ask of Faye? We have nothing in the Q&A yet.
We have one question, I
We have
see,
one
popped
from
up.
Corinne. Yes, Corinne, you can type here. Just waiting for Corinne's question. Or maybe I can unmute you, Corinne, and that might be. There, Corinne, you should be able to speak. Okay. Corinne is asking, I was wondering if you had any experience with GaitBetter assisting helping people with vision impairment in addition to neurological.
Yeah, I think when you treat a patient that suffered a stroke or a traumatic brain injury, you sometimes get the full gambit of needs, which may include visual needs as well. So the game I was referencing, the cat search game, is a game, that I think could be easily used for scanning the environment if you wanted to work on, range of motion, or scanning, or working on saccades, even in vestibular therapy. The cats can be formulated in different sizes. So based on what the patient's vision is or what their attention is, you can kind of make the cats super large where they take up the full screen, and it's a lot of errorless learning for the patient, and then eventually kind of wean them down and make them a bit smaller as well. So I think there's a lot of advantages to it. A lot of off-label uses. Yeah.
Thank you.
You're welcome.
Thank you very much. Thank you for the question, Corinne, and thank you for the answer, Faye. If we have no more questions for Faye, I'm going to let her go to our other engagement, but I want to thank you very much for taking the time out of your very busy schedule today to talk to us, to give your feedback and your insights. It's always great to hear from people who have, using the system for many years in clinical situations and have so much experience delivering, the treatment and the care to patients. So thank you very much.
Of course, you're welcome. Thank you for having me.
Thank you.
Thank you very much.
Bye.
So we're almost at the